Welcome everyone to Healthcare for All, brought to you by WCANradio.com. This program examines the issues of healthcare for you. Join us now in the studio where the program is in progress.
And good evening. You're listening to Healthcare for All with Eric Meadows and Debbie Silverstein. You can be an interactive part tonight by calling in toll free at 1-800-921-2204, or you can send an email to WCANradio@yahoo.com. And just to let you know, Debbie and Eric, we do have some emails that came in from last month's program, and we'll entertain those real quick before we get started here.
Good.
And the first email, this is a shout out to you, Debbie, and you, Eric.
Okay.
You're going to like this. This comes from Sarah Logan. And she writes, "Thank you for the wonderful Healthcare for All program. It is so well organized and informative. All of the guests have been incredibly well spoken about the great need for single-payer health care. Deb Silverstein is a real asset to the program. What an intelligent advocate for the cause. Eric, you do such a nice job facilitating the conversation also. I look forward to the program each month. I also hope to become more of an activist myself. These women inspired me this week. Thank you again. Sincerely, Sarah Logan."
Well, Sarah, we hope you do become active with us, and thank you very much for that email. That was very, very nice of you.
Yes, it was.
Very nice. This next one comes from Alice Farina. If I said that name correctly, Alice. Forgive me if I didn't. Alice Farina. She writes, "I noticed that the New York chapter of PNHP has made a presence at the Wall Street protests. Is this catching on in other cities?"
Yes, in fact, there is the 99 healthcare for the 99%, which is part of the Occupy movement, and there's the Healthcare Occupy in Boston, and there's been some activity here in Cleveland as well. It is part of the whole Occupy movement, which is dealing with the great disparity in the distribution of wealth and resources in this country, and healthcare is one of them.
You know, Debbie, if I can just add to that, this movement, Occupy Wall Street movement, it's actually sweeping the country. It might seem like a small wave, but if it continues on, it's going to have a mighty big effect.
It could very well.
Yes.
Okay, and this last email comes from Bob Heidesek from Midland, Michigan. Do you know him, Debbie?
Yes, I do. Hi, Bob.
All right, he writes, this is from last month. "Debbie, sorry that I did not get this clarification composed and to you during your program. The radio person seemed very sincerely interested in the healthcare for all topic. So I am providing this for both his and your education. You will find a complete coverage of what the members of Congress get for healthcare at the first link below. Primarily at the second link, you will see that the use of the health offices, the title used during the program, is an option for members of Congress who can pay a yearly fee of about $500 to use those services, which are titled the Office of the Attending Physician, OAP, which is actually multiple offices if I recall correctly. The members of Congress do not automatically receive their services. It is not likely that those particular services are available to the public as implied during the program. An exception to that would be some extreme unique emergency in which members of the public happen to be involved. All the health care benefits of the members of the U.S. Congress, you can find it at this link at www.medicare4all.org/pages/Congress_health_care. The other, their special health care benefits, especially including the OAP, can be found at www.medicare4all.org/pages/special_health_care_4_Congress. I just did some more research, he goes on to say on this tonight, confirming that the yearly fee has not changed much in the last 20 years. Somewhere within the range of $500 and $520 has been the cost. For those members who want to take advantage of the services, I added to the second webpage at the bottom, there is a Wikipedia article that includes an explanation of the entire scope of the OAP. Regards, Bob Heidesek, Midland, Michigan.
Yes, Bob did contact me after the show. Apparently one of our guests said that those services were free to the members of Congress and to anyone visiting, and he wanted to correct that information. And we thank you, Bob, for doing that.
You know, while we're giving out acknowledgments, before we go to our phone call, I'd also like to thank Barbara Walden for the gift of the healthcare movie that's narrated by Kiefer Sutherland. I did want to let you know I had received it, and I do thank you for it. I've watched it multiple times. Hopefully we'll get a chance to talk about some of the points of it. If not in this show, then in future shows. But we do have a caller on tonight's show. Go ahead, caller.
Hi, my name is Dawn Ring, and I'm calling in because Debbie invited me to call in.
Okay. And where are you calling from?
I'm calling from Solon, Ohio. It's a suburb outside of Cleveland. And I have recently filmed for a documentary. I'm sorry, I'm nervous.
That's all right.
Hey, Dawn, it's okay. Why don't you stay on the line? Don't hang up. Let us introduce our guest tonight because he's the one that got you into that documentary, and then you can tell us what your story is.
Okay, sure. Thank you.
Okay, tonight's guest is Mr. Gary Benjamin. He is an advocacy coordinator for UCAN, Ohio. He's also an attorney in the state of Michigan and a staff attorney for the Michigan Legal Services. We do want to welcome you out here tonight, Mr. Benjamin.
Thank you for having me, and that's the first time, Dawn, I've ever heard you say you were nervous.
Well, you know, Dawn has a special story to tell, and it's her story will kind of highlight why we're in this working for healthcare reform, even though we've had healthcare reform. Dawn kind of fell through the cracks with healthcare. So, Dawn, why don't you tell us what happened to you?
Oh, my personal story?
Yeah.
Well, Dave and I, we've been married 38 years, and we've pretty much always played by the rules. We both put ourselves through college twice. We thought that we would be like most Americans, that we would raise our children, which we've done. We've lived in our home for 22 years. We have 2 beautiful grandchildren now. We were saving for retirement, and we thought we would basically live the American dream. Well, then, unfortunately, our big irresponsible sin was that I was diagnosed with aggressive cancer at the age of 41, and Dave was diagnosed with cancer at the age of 52. And so for the past almost 2 decades, we have been just horrendously squeezed financially by the for-profit healthcare industry. And because of that, even though we pretty much were able to overcome that, it just got too egregious for us. And as of August 1st, this past August, we had to give up our health insurance because they had raised our premiums to $2,500 per month, and that didn't include co-insurance, co-pay, deductible, or anything. They just arbitrarily didn't pay. So that would have been $30,000 out of pocket. That was without the add-ons. That was basically over half of our income. I don't know any middle-class people that can afford that.
There aren't any, Dawn. There aren't any.
And we make too much money for any kind of subsidized help, but we make too little money to pay the egregious premiums which the insurance companies demand. So it is a rigged system. That's why I feel I not only want single payer, but I also feel like I'm one of the 99% because I feel the system's totally rigged.
Dawn, I have a question to ask. Now,
Sure.
Prior to your actually telling us about this, Debbie made the remark that you're one of those who have fallen through the cracks. Now, you did have medical insurance. What was it that it was not doing for you that caused this problem?
Well, I'll tell you what. In the 90s, when I was first few years after I was diagnosed with cancer, we had insurance. We had full coverage, yet we still had to file for bankruptcy. We had zero credit card debt, but we had a $30,000 hospital bill, and they were going to put a lien on our home. So we had to declare bankruptcy when we had full insurance coverage. So that started this cycle of financial difficulty when we had insurance.
Well, just what, if anybody can you tell me what is full coverage?
Well, full,
If it's not full coverage, you know what I mean?
Well, see,
Eric, full coverage still you have deductibles that you have to meet, and you have co-pays that you have to meet. And I don't, when did the
well, what in our case, what it meant was there was a particular service that they said
They didn't
I
cover.
had met my lifetime limit on a
Okay.
particular service, so they weren't going to pay that. So you can choose. This is where right now we're in this Hobson's choice. My husband just got sick last weekend. Well, no, weekend and a half ago, and we had to take him to the emergency room. And we were deciding should we go or should we not go because it was a Hobson's choice. Either my husband, we save my husband's life and we become homeless because our only asset is our house, or he dies. I mean, what kind of choice are Americans in today?
Well, that's right, and a lot of people, this is Gary, by the way, a
Yeah.
lot of people have those similar choices. I've heard of people who have good union insurance who have 20% co-pays for the spouse. And if the spouse needs something pretty impressive, like a liver transplant, which is $100,000 to $200,000 procedure, you're going to have a $20,000 to $40,000 debt.
Mhm.
And
Right.
that kind of copay is just outrageous.
It
But
is.
it's there, and that's how insurance companies, under the present system, the business model we've got, allows insurance companies to do that, and that's how they keep their bottom line either even or in the black. Otherwise, they say if they can't discriminate against sick people, they claim they can't make a buck and they can't stay alive.
And you have to understand that insurance companies are in business to make money. They're a business. You know, they're not there to do philanthropic work. You know, it used to be that we had the nonprofit insurance companies, but they've all been pretty much bought up by the for-profits. But if you're a business, you're in business to make money.
Right.
Now, Dave and I had Medical Mutual, and they claimed to be not-for-profit, but they priced us out of the system, so I don't know how they can claim to be not-for-profit.
Well, now you had your insurance was through Dave's employment, correct?
Right.
But
We had to pay 100% of everything.
you had to pay 100% of the premium.
Right.
And my understanding is it was a very small business.
It was with Cozy.
It was with Cozy.
Yeah, we had fewer than 5 employees,
Okay.
and Dave and I were both. But see, we're both cancer-free, even though we're cancer survivors. But they term us, people like Dave and I, the insurance companies term us heavy utilizers, and that's used as an ugly euphemism for people like us.
Mm-hmm.
Dawn, you know, now you said as heavy users. This is a one-time occurrence. I mean, it's not like every few years you're coming down with cancer. So how do they put a term like that on you, you know, to say a heavy user? Simply because at one particular time you had a catastrophic illness that, you know, kind of took you for a loop, But
that's the history part of it. When they look at your medical history, they use all of those things to determine what your rates are going to be. And so if you have a history of having had a disease in the past that has been expensive, then they're going to assume you're going to continue to be expensive, and they're going to base your rates on that.
But basically our medical system is not based on that. Once they work towards a cure and have cured you, that's not supposed to be a repeat performance. Am I right or wrong?
For pre-existing conditions, it's based on your history, though, and then you could be completely cancer-free and not at real risk of catching anything again, and they would still treat you as being a higher risk. The other thing Dawn mentioned was that she hit her cap for her that one procedure. And one of the things the Affordable Care Act, or we're going to go use the whole name, Patient
Yes.
Protection and Affordable Care Act, Obamacare to me, it eliminates those caps. So, for instance, right now lifetime caps are gone, and annual caps are going up until 2014 when they will be gone too. So that'll be a problem she doesn't have.
There's a problem I still have now, though,
Right.
is that even with the Affordable Care Act, the insurance companies are still permitted to charge, you know, I'm going to be 60 years old in 2012, so insurance companies are still permitted to charge people like Dave and I at least triple what they charge everyone else. And so if there are any spots left in the high risk pool as of February 1st, it's with Medical Mutual, and that's who we had. So if there are any spots left, they may just charge us as much as what we couldn't afford in August.
Well, it won't be $2,500 a month.
Okay.
One of the things the Affordable Care Act did was set up these pre-existing condition pools. There should be slots left. I've not heard that they're filled. And they're supposed to charge you only what they would charge someone of your age at the healthy rate. And the government pays the rest. So you can go online on Medical Mutual's website and look up what your rate would be actually, and it'd be in the $400 to $500 a month range probably still.
I think the only thing that they're allowed to charge more for is tobacco use.
Right.
Oh, we've never even, I've never, Dave and I don't smoke cigarettes. I've never smoked a cigarette in my life.
So you lived a healthy lifestyle, but you got sick
Oh, yeah,
anyways.
when I got cancer, I was very thin weight. I was very active. I never smoked a cigarette. I didn't have one single risk factor. It was an extreme anomaly.
Well, the other thing the Obamacare does that I like a lot is, Dawn, if you are in 2014, get your insurance through the exchange, all of your congressional representatives, senators and congressmen and congresswomen and their staff will have to be in the same exchange with you. That's the only real mandate in the whole act, where 100% of the 535 members of Congress and their staff actually have to get insurance through the exchange. And what I like about that is it gives us 535 advocates that are going to be carefully watching this system and making sure it works for them, which will mean it should work for us. And I think that's one thing they did right. That was a Senator Brown amendment, actually.
Was it?
Oh, Sherrod Brown?
Yes.
He's a great senator.
Well, good for him. And is there any other way? I mean, right now the high risk pool is an option for Dawn.
Well, we still have, we won some changes in the pre-existing condition pools before Obamacare was passed. So each insurance company has a period of time during the year when you can sign up if you have a pre-existing condition, and those rates are controlled to some degree too. I think Dawn was in that system though. I'm not sure, but those rates can still be pretty high.
Right.
That's the problem, and a lot of people who really need insurance can't afford it, and that's, well, it's one of the reasons we had to have reform. Dawn talked about going bankrupt even though she was insured. That's not uncommon. A lot of people get medical debt even though they have insurance, and we absolutely had to change that, and at least the Patient Protection and Affordable Care Act does that much.
Right. We've been talking about the high-risk pools, and Dawn, you're planning to apply to the high-risk pool come February?
Well, I'm hoping they have some spots left because a couple months ago when I was looking into it, you know, it's a prerequisite that you have to be uninsured for 6 months in order to apply.
Right.
And I had been told that the spots were filling up quickly, and that because so many people were signing up and because they were having to charge more than they thought, excuse me, they were running out of money and spots. So I don't know that they'll have openings by February 1st when Dave and I are eligible to apply.
Let's hope they do. But Gary, can you explain to us what that high-risk pool is?
It's actually a little insurance company set up that Medical Mutual has a contract with the state to run, and the state gets money from the federal government to subsidize premiums for people with pre-existing conditions. So if you have a pre-existing condition that's blocked you from getting insurance or caused your insurance rates to be extremely high like Dawn and Dave's were, and you can't get coverage because of that, then you can go to this Medical Mutual website and also the Ohio Department of Insurance website, and you can sign up for this there, and the premium should be a lot less than they're sticking you with now.
And every state should have one of these?
Every state has one.
Thank you.
You're listening to Community Healthcare for All. We'll be right back.
Most of us look at the world like nothing bad will ever happen. An Allstate agent knows that all too often, it does. And they offer innovative ways to help protect your world. Like accident forgiveness, identity restoration coverage, and life insurance for the unthinkable. These days, you need more than just an insurance agent. You need an Allstate agent, someone who makes it their business to help protect you. That's Allstate, Stan. Are you in good hands?
At JCPenney, you'll find more things that last.
Because we put quality first. We feel better.
And look brighter.
With more things made to stand up.
More things designed to lie down.
And more things you can count on.
Over.
And over.
And while quality is something we look for first,
our great values have made us
a name that lasts.
At eHarmony, you don't scan through thousands of pictures looking for your perfect match. Where's the value in that? We pre-screen each and every member for you to determine your matches based on compatibility. So when you get to that first date, you know you'll have something in common. eHarmony does the matching for you based on who you are at the deepest level. Aren't you curious to see who you'd be matched with? Log on to eHarmony.com, where it's absolutely free to review your matches.
Welcome back to Healthcare for All, sponsored by SPAN Ohio. We're here tonight with our guest, Gary Benjamin, and we're going to invite everyone that's listening to participate in the show. If you have a question or a comment that you'd like to make, please call us toll-free at 1-800-921-2204. That number again is 1-800-921-2204. Or if you'd like to email us, you can do that at WCANradio@yahoo.com. That's WCANradio@yahoo.com.
Our last conversation was with Dawn, and we're going to go back to that, but I also believe we have an email. So which do we want to handle first?
Okay, well, we can go to the email real quick. I believe Dawn is still on the line.
Yes,
Just to
I
let
am.
you know, she's still there. All right, this email is coming from Arlene Sheik in Athens, Ohio. She writes, "Thank you for this very informative show and a chance for the exchange of ideas and this vitally important topic. I understand that PPACA has enabled 2.5 million young adults to obtain health care coverage through their parents. Do you think that selling this many more policies to a mostly healthy population attracts insurance company investors? Do you think that the law that forces 80% of future universal single, 80% of insurance company earnings into actual health care drives away insurance company investors? Do either outcomes build alliances for a future universal single payer system, which I see as the real solution?" Again, Arlene Sheik, Athens, Ohio.
And we want to thank Arlene for sending that question in. Gary, any thoughts on that one?
Well, I don't know if the Obamacare is going to push us into a situation where we'll end up with a single-payer system or not. We supported it in our organization mainly because it would cover a lot more people and at least set up structures like these insurance exchanges, I guess we'll talk about in a minute, that will make more sense out of the insurance market and allow competition to weed out the insurance actors that aren't doing their job right. And the two questions that Arlene asked about young people getting on their parents' group policies, I don't know if the number was that high, but it's hundreds of thousands of young adults were able to go on their parents' policy, and a lot of parents across the country are very relieved at this. It's probably the most successful part of the ACA, and it was designed to bring money in to these insurance companies that they probably wouldn't have to pay out for healthy people to spread the risk so that the rates for those of us who are not so healthy might at least even out. The other thing she raises, the 80% or 85%, it's called the medical loss ratio, and in shorthand she had it right. It's the insurance company, this is another Senator Brown amendment. The insurance company has to spend 80% of the premium dollar in the total So if an insurance company brings in $1 million, it has to spend $800,000 on health care. If it doesn't, I like this part, they have to rebate money to all of their members to make up the difference. So they have to spend 80% on health care or give you enough cash so that it makes the same deal. Now, it doesn't mean they have to spend it on you, but totally on their population, because hopefully you won't need insurance. That'd be the best of all possible worlds. That was put in partially because we did not get the public option. That was kind of the replacement to try to keep costs down and keep people covered. I don't think that insurance companies are hurting. I don't think any of this has driven anybody away from investing in the insurance companies. It seems like they're doing really well. And as of 2014, they're going to benefit from an awful lot of federal subsidy money as well. So my guess is the Obamacare actually is helping the insurers.
That's what I've heard. In fact, there was an article about the CEOs of the health insurance companies have actually surpassed the bankers as far as salary and compensation packages go. So I'm guessing no, they're not.
So
hurting
we're in
at
the
all.
wrong business.
I'm definitely in the wrong business. So.
Would you like to hear about the documentary? This is Dawn.
Yeah.
Sure. Shoot.
Okay, Gary, you had referred me to Sean McDaniel, and he came out from Connecticut. He has his own film company called Film and Noise, and his production of this documentary is sponsored by United Republic, and that is a new organization that has gotten together to get the money out of politics. And this organization is it's nonpartisan or bipartisan. They would like to get Democrats, Republicans, Independents, everybody to realize that the problem with our democracy is that there are so many special interests and lobbyists that are paying or muddying the waters. There's so much money in politics that actually the lobbyists write the bills, and they don't really represent us. So he came out to make a documentary, and Sean filmed me mostly about my healthcare situation. And the last thing he asked me is if I could have anything I wanted right now, what would it be? And I said Medicare for all. We all pay in, and we all get it out. It would be the most efficient system because the United States of America pays double for health care what any other nation does, and we have much more I don't know how to say poor results. So it's inefficient at best.
Yeah, and Dawn, I would agree with you on that the system is inefficient. It's not a question of quality care. We have quality care available. The biggest question, the biggest problem for us as a nation is access to that care.
Right.
Which is something that you have demonstrated with your story, that it is a problem. When you have to stop and think, do I go to the emergency room or not? Do I just stay home and die? There's a real problem there.
And it's it's getting worse, too. As the insurance companies see that they're going to have to be better citizens of the country with having to, account for 80% of the premiums, I think they're being worse citizens right now in the lead up to 2014, and that's why all of us are getting harder hit right now. They're trying to, right? I mean, that's my hypothesis.
Well, that's probably accurate. We had a meeting with Congressman Kucinich probably a year ago now, and he's been looking, as have we, for stories of people who get stuck with outrageous premiums before 2014, because the more of those stories we can find and build a record on, then we can go at least advocate for some change. As of 2014, one of the things the Obamacare did was it changed the business model for insurance companies, so they will have to be better citizens, which is to mean they actually will have to pay out money to take care of people. I've seen some companies that pay out something like 55% of their health care dollar for coverage for medical care, and that's really absurd. But as of 2014, they can't discriminate against you because of a pre-existing condition. They can't discriminate against women in terms of premiums. They can't have caps of any sort. If you had a cap that you hit, your insurance company is supposed to put you back on their policy. There's a whole series of things that happen that take away the bad business model we have now, but we still have that business model now, and insurance companies are having to do some things under the new act that they claim are boosting premiums. We don't buy that, but we'd like to know what's happening with people. So my email address, if I can do that, is gbenjamin, GBENJAMIN, at UHCAN, or I suppose you could just email in here and I'd get it too. But we like those stories.
You know, this conversation is so great. It's generating emails. So let's get to those.
We do have emails, but Dawn, if there's nothing further, we are going to have to free up the line. Okay.
Okay. Thank you very much.
We do have other callers wanting to get in.
Bye, Dawn.
All right.
Thank you, Dawn.
Thanks, Dawn.
Bye-bye. Okay. This comes from Alice Farina, and she writes, my question is, what can be done about the Lieutenant Governor's blatant decision to stall setting up the exchanges in defiance of the federal law?
I can put in a plug for my meeting tomorrow morning here, huh?
Go for it.
Go for it, yeah.
Senator Skindell is writing his own exchange bill that we are confident we're going to like, that's going to meet our criteria for what a good exchange bill will be, and he's coming to our meeting at Trinity Cathedral tomorrow, 2230 Euclid in Cleveland, to talk about what he is intending to do. So that's one way we're going to try to push them, is we're going to put out our own bill. Ohio is dragging its feet, and I would put a shout out here to Governor Kasich to tell Mary Taylor to get in line, because he's been telling us we're going to have an exchange, and still letting her run around the state dumping on Obamacare and saying we aren't going to have an exchange. So I think he needs to man up and tell her to get in line.
Well, what happens if we don't do an exchange, Gary?
The feds come in and set it up for us, which, given who we've got in power, might not be a bad option. But our understanding is the federal government will contract with somebody in the state to do it.
Okay.
So I would just as soon have it be under the state government, even though who we've got doesn't seem to like the idea much.
Okay, we have another phone call. Go ahead, caller. Can you tell us who you are and where you're calling from?
Yes, sir. This is Larry Silverstein from Midland, Michigan.
Hi, Dad.
I have read that Medicare administrative costs run about 3% of their income, and insurance companies, on the other hand, 30% overhead costs. And in another source, I read that we'd save $350 billion a year in administrative costs and profits. So the question is, how do we get rid of the insurance companies?
Good question. Because
Vote for the Healthcare for All Ohioans Act would do some of that, I think.
I think what you need to do is, first of all, the legislators that we put in place are the ones that are going to be making that move, depending on the state that you're in, because some states don't have referendums like Ohio does. They can't do it that way. So you have to rely on your legislators, your state legislators for a state program, or your federal legislators for a federal program. I think you need to let them know how you feel about that issue, and you need to keep letting them know. Just writing once isn't enough. Write to them once a week, and get your friends to write to them, and get your family members to write to them. You have to put the pressure on them in order to get something like this done.
I should add, Larry, that I do work in Michigan, and I was actually up in Lansing today meeting with the insurance commissioner's office there. and they have the same political setup we do, with the party in power being the one that doesn't like Obamacare. But they are pushing ahead. There's an exchange bill in Michigan that's passed the House already. Governor Snyder is pushing ahead to do the right thing, at least to some degree, with Obamacare. There isn't, as far as I know, a single-payer state organization in Michigan like SPAN Ohio, but there are organizations that work on the Medicare for All bill. Mm-hmm. And I'm hoping you're hooked up with them, and if you're not, email me and I can tell you where to hook up.
All right, very good. Am I on the air? I hope not.
Yes, you are. You're still on the air, Dad.
So be careful what you say.
One of the things I did want to state is that insurance companies aren't going to go completely away.
No.
I do believe they will have to restructure what they're doing, and it's going to cut into their profits, but they're going to have to begin to start servicing the American citizens.
Yes, they are, and they understand that too, and you're seeing some moves that they're changing their business model because they understand that. And eventually, what we're doing right now, I truly believe is going to become unsustainable. Because if you look at the experience in Massachusetts, the first effect it had before the recession is it simply made Massachusetts healthcare the most expensive in the world. We can't afford to keep going down this road and spending more and more and more money and not getting very much for it. We're going to have to take a real serious look at trimming some of those costs, and we have to look at what healthcare is. Healthcare needs to be there for the public good, because we have public health concerns that we are concerned about. The other thing too is we have to look at the fact that healthcare is a human right. You can't have life without access to healthcare. If you take away that access, that can very quickly cut off that right to life that you have. And we have to start looking at that. And we have to remember that we can achieve more when we work together and when we pool our resources and we work for everyone. One of the ways an insurance company works is they talk about insurance pools. Larger businesses can get better rates from an insurance company than a small business can. And that's where Dawn was with her husband getting it through COSI. They were a small business, only 5 employees. And so their rates, one person getting sick can really jump those rates. Hey, Dad.
Yes.
Time to say goodbye. Open the line up, okay?
Did you take that remedial caregiver course I recommended?
No, I didn't.
Okay.
Good night.
Thanks for calling. But what a single payer plan does is it creates the largest risk pool that you can because it puts everybody in. So it lowers, what the costs are for each one of us.
That's true.
Well, and one of the things maybe two of the things I should say that Obamacare does is it does require insurance companies to do more along the lines of community rating and treat everyone the same. So the risk pools should start looking more like single payer type bigger risk pools. And the other thing it does is it tries to push the delivery system more in the way that universal healthcare countries have it, whether they're single payer like Canada or the National Health Service places like Britain or Sweden, or they're the French or German systems where they have hundreds of small nonprofit insurance companies. One of the things they all do is they try to control both the health of their populations by making them more healthy, stay out of hospital, have a healthcare system rather than a sickness system where, someone like that has pneumonia, that has a cold, doesn't go to the doctor and it gets to pneumonia.
Right.
So those systems all focus on preventive and primary care, and we don't. And Obamacare does have some provisions in it that'll flip our system over at some point to be more like that and allow us to move into more universal coverage.
Okay.
You're listening to Ohio Healthcare for All. We'll be right back.
Bicycle, what are we waiting for? The flowers are blooming, the air is sweet, and Zyrtec starts relieving my allergies 2 hours faster than Claritin. My worst symptoms feel better, indoors and outdoors. With Zyrtec, the fastest 24-hour allergy medicine, I promise not to wait as long to go for our ride. Zyrtec works fast, so I can love the air.
May I help you?
Hi, I'm looking to save on car insurance, but it's got to be right for me.
Well, let's check out the Dave aisle.
Excuse me?
The Dave aisle, where your perfect policy is customized just for you. It's all here. The coverage you want, any discounts you get, all at a great price.
I have an aisle. Why is that guy in my aisle?
That's Steve. He works here.
Getting just what you want at the right price. Now that's Progressive. Call or click today.
At JCPenney, you'll find more things that last.
Because we put quality first. We feel better.
And look brighter.
With more things made to stand up.
More things designed to lie down.
And more things you can count on.
Over.
And over.
And while quality is something we look for first,
our great values have made us
a name that lasts.
Welcome back to Healthcare for All, sponsored by Span, Ohio. This is Debbie Silverstein. I'm in the studio tonight with Gary Benjamin, our guest from UCAN, Ohio, and with Eric Meadows. And we've been discussing some of the things that the Patient Protection and Affordable Care Act will do for us as a nation. There are some, you talked about some of the things that the insurance companies had to do, but there are some exceptions, aren't there, Gary?
Exceptions to what they have to do?
Yes, the patient protections and the grandfathered plans.
Grandfathered plans don't have to follow the act until they become ungrandfathered. And the way they become ungrandfathered, so in other words, they could still have caps,
right,
or limitations on pre-existing conditions. But we haven't felt that that's a big concern. People who want to learn more about it, the Communications Workers of America had a really good memo online if you're into reading minutia of the act. That I thought it explained it better than anything else. But as plans change, and they all do, every year they change, they lose their grandfathered status, and then they come under the act. So if the premium goes up, the co-pays go up, the benefits change, and that seems to be happening generally before 2014 with all plans. I haven't seen any studies yet, but it doesn't look to me like it's likely any plan will still be grandfathered by 2014.
So, but basically what I had heard is if the plan was in place when the act was passed, that the plan was grandfathered unless, and they could have some premium increases or copay increases that were they considered small or reasonable, but if they were large or substantial, then that would ungrandfather them. And the question is, where does that lie? And some people may want to know if they have a grandfathered plan, and how can they find out?
Well, there's three places to ask that. If you're in a union, I'd call the union hall. They'd know most, because most of those plans would be grandfathered for a while, and they're good plans. Otherwise, call either your employer or the insurance company or both, and ask them whether your plan is subject to Obamacare or the Affordable Care Act or not, and they should be able to tell you that.
Okay.
If you still have, you can still have a certain level of annual cap, but you can't have lifetime caps. I think it is now.
Good. Okay. If any of our visitors or listeners have questions that they'd like to call in, I'd like to remind you that the number is 1-800-921-2204, or you can email us at wcanradio@yahoo.com.
All right, this comes from Dawn, and she writes, or she actually gives us a recommendation to a book. The title is Deadly Spin. The author's Wendell Potter. The bio, a whistleblower for the insurance industry, and it's recommended by Bill Moyers.
Yeah. Potter was an executive for an insurance company, and he goes around the country talking about their bad actions very convincingly.
Yeah, he worked for Cigna Insurance, and he said his moment of understanding was when he attended one of those remote area medical fairs that they were having, where they treat people for free, and people drove for hundreds of miles, spent the night in their car, and when he saw people being treated in horse stalls, he said, my God, what are we doing to people? But that's what they were doing, and that's what they were willing to go through in order to get the care that they needed. And an interesting thing is remote area medical was started to work in third world countries, but they do the majority of their work now here in the United States. So we've been talking about what the Affordable Care Act does do for us. Where does it fall short, Gary?
Well, I'd say the main spot it falls short is that it doesn't cover everybody. Healthcare is a human right to me, and the Act does not recognize that. It does not meet that level. In fact, of the 48 million that were uninsured at the time of the Act's passage in 2010, they estimated 32 million would be covered. A part of that that's good is that half of those people would become eligible for Medicaid. Another little-known piece of Obamacare is that it's a revolutionary act with regard to Medicaid. If you get to 133% of the poverty level, you would be eligible for insurance through Medicaid and not have to pay a premium. Above that, you might. But that's still left, and now with the economy going bad, it's still left a substantial number of people uninsured. That's just unacceptable.
Well, how do you stay uninsured? I thought if you were uninsured, if you didn't buy insurance or you didn't qualify for the Medicaid, that you had to pay a penalty or a fine.
That's what the media would like us all to think, and that's what comes out in the sound bites. Diane Suhetka had a good column on this that explained it pretty well in the Plain Dealer. I don't remember the date, but if people want to look on their website for her column on the mandate, it explains it pretty well. But basically, there's 6 or 7 exceptions to the mandate.
Okay.
3 of them have to do with economics. So if you don't, for instance, don't file an income tax return, that would indicate you don't have enough money to be subject to the mandate. You don't have to pay the fine. You're not subject to the mandate. There's a section that is yet undefined that talks about financial hardship. That's not, there's no regulations out about that yet, but the idea is that if it's too hard for you to buy your insurance, and it could be for any number of reasons, I suppose, then you're not subject to the mandate. But the biggest one is there's actually a clause in the Act that says if your premium would cost more than 8% of your adjusted gross income as reported to the IRS, then you're not subject to the mandate or the tax.
Oh.
So there's a good chunk of people that will be outside the purview of the, I'm being lawyerly here, sorry, outside the Act, then you'll skate. The other piece is that the Act actually allows choices, so that if you call up the insurance exchange and say, I need an insurance policy, and they say that'll cost you $3,000, and your income is, let's say, $30,000.
Okay.
The first year, you can decide not to buy the insurance and pay a fine that's 1% of your income, $300. The good thing about that is that that $300 will go into a fund that'll help pay for health care for people that still are not covered by the Act. So that the idea is it'll lift some of the pressure on those of us who are responsible enough to keep ourselves insured. Because we do that, people who aren't insured, when they go to the hospital, can't pay. That price that the hospital would charge them is spread out among all the customers who are insured. And there's a $600, $700, $800 amount on everybody's premium to cover uninsured people. A certain number of those uninsured people could afford health insurance, and the Act tries to force those folks who can afford it into either buying insurance or contributing to the system. So let's say you made $100,000. Your policy was $3,000. That's not 8%.
Right.
You pay the policy, or you pay 1% of your income, which at that point is $1,000. It starts to get closer. That's the math.
Okay, well, Gary, the problem I see with that is the person who decides that, let's say, if he's making, $30,000, and he does pay the fine, that $300 or that $100 or that $300. When he does get sick, does he automatically now have to pay the $3,000, or can he just be treated offhand, or is that money that's coming from the fine going to help pay for his health care? Because you're going to create a whole new society then.
Right, and that's another problem with the Act. If you choose to pay the fine and not be insured, and you should have been insured, you're going to have to pay the bill for your care. If you can't, you're going to be back in the do I go bankrupt situation. So it's not a real good choice to make, but people do it.
What's to stop them from saying, okay, listen, I'll just go ahead and pay for that insurance up front? Not so much for the care, but for the insurance. Can they backtrack and say, okay, I want the insurance? Can't do that?
No.
You have to buy it. Once, that was a big fight, actually, and the reason the mandate is in there is they figured if they set these exchanges up with these good conditions, like you can't discriminate if you're sick or if you're female, or or you can't have caps the way we do now. The fear of the insurance companies was that people would wait till they got sick and then go to the exchange and say, give me insurance, and the insurance would have to give them insurance when they were sick, and that would jack everybody's rates up. So the notion was we want to get people in the system early
while they're healthy and they don't need any.
Right.
Here's the thing, Eric. It's estimated that about 20% of the population uses about 80% of the care. So that means 80% of the population is relatively healthy and isn't using much care at all. In order to pay for the 20% that is using all the care, we need the other 80%. We need their contributions as well.
Right. Okay, well, let's look at Medicaid now. They're going to have to restructure Medicaid. I mean, the way it presently is, you have those that are below the poverty limit, or 135% below that poverty limit, are not going to continue to go in every month to reapply for a service that is, in fact, their right. How are they going to redo Medicaid?
Well, that's something we're working on state by state. The application process often is you have some states you have to reapply every month, some are every 3 months, some are every 6 months. I think the standard's 6 months now.
Well, here in Ohio it is every month.
Yeah, and that's something we'd like to see changed and made stretched out, because it doesn't make sense. If you're at 135% of poverty level, you might get lucky and get a raise, I guess, and get outside of Medicaid, but you're not going to fall out of eligibility the way you would now.
Okay.
The other piece is if an exchange is established, either by the state or federal government, we would advocate that Medicaid determinations be made at the exchange level, so that if someone comes in, I'm at 100% of poverty, I get Medicaid, I report I went up to 180% of poverty, now I get insurance. And that's a private insurance. Making that a very easy, seamless transition makes sense. And you might fall down from 180% to 100% too. Then you should just be able to fall into Medicaid. The system should be
Now,
simple.
is that going to be a seamless fall, where it just kicks in? Or are you going to have to go through the process of actually, you don't qualify for this, but now you have to go in and put in the application?
My answer is this is Ohio.
True. Okay.
Real quickly here, we just got an email. This is a reminder for Debbie. This is from Kurt Bateman. He writes, the healthcare movie will be shown across Ohio by Span Ohio advocates. Look at www.spanohio.org for public screening dates and locations in January, or contact a Span Ohio coordinators like Debbie to arrange small group screenings. Again, from Kurt Bateman.
Okay, and just quickly, the healthcare movie chronicles the differences between our system and the Canadian system, and how the systems were once alike and how they diverged and the paths that they took. It's a very interesting movie. And I want to say thank you to everyone that called in tonight or wrote in tonight. We had some great participation from our audience. In that. And thank you very much to Gary for coming and telling us. I think the Affordable Care Act is a very difficult one to understand for most people, and most people don't understand what's really there. But we thank you for coming in and explaining it.
Thanks for having me.
You're welcome.
It was definitely a pleasure. Again, like you said, the listeners, we're really growing. We're really growing. I believe this is our fourth or fifth show. And we've really broken some records, so I like that. I like the listeners' responses that we are getting. And for those of you that are health professionals over at the VA, I do want to thank you for your participation in it. I know that they've been asking me a lot of questions about this. And We've just been doing a wonderful job. You know, Debbie, since you've joined us here at WCAN, it's just been absolutely wonderful.
Well, thank you, Eric. I've really been enjoying this. This is fun, you know, and I have no experience in doing radio and that, so this is a total learning experience for me, but it's been a very fun one for me.
One thing I do want to ask, if you can tell our listeners where they can go to sign a petition, or, you know, not just writing their political leaders, but where they can go to sign a petition for single payer.
Here in Ohio, you have to go to a SPAN member who has a petition. There is no online petition because these petitions are to put the issue on the ballot. Okay. And you cannot do that online. So you have to find a SPAN member that has one. You can find one by going to the SPAN website. That's www.spanohio.org. And if you look under contacts, you'll find the different regional coordinators for the different regions, and the counties are listed underneath, and there's contact information for them, and they can tell you how to get a petition to sign.
Okay, and who do we have for our next show?
Our next show next month is we're going to have State Rep Bob Hagan from the Youngstown area. He is one of the sponsors of the Ohio Healthcare Security Act, and he's going to be here talking to us about healthcare being a human right. Healthcare is a human right.
Okay. We do want to thank everybody for having continued to participate with us.
And just to let everybody know that sorry we couldn't get to all of your emails, but we do promise we will get to your emails on the next month's program. And for anybody who would like to send an email before next month's program, you can do so ahead of time. You can send it to WCANradio@yahoo.com and just head it up, Healthcare for All. Until next time, you have a great night, and we'll see you right back here again.
Thank you for listening, and join us every third Thursday of the month from 8:30 to 9:30 p.m. Eastern Standard Time on Healthcare for All. Until next time, stay healthy.